From the Toronto Star, I'm Adrian Cheung, and this matters. Hey, Nick.
Hey, Adrian.
This is Nick Zarowny. Nick is a Canadian who's lived in Taiwan for 2 decades teaching English and Kung Fu. Pretty cool, right? He and his family live just outside of the capital city of Taipei.
We're like Oakville compared to Toronto, so it's a little bit suburbs.
We wanted to know what it's like living there during the pandemic, because to hear him talk about it, Taiwan might as well be another world. So Nick, what is Taiwan like right now? Are all the cities shut down?
I've got family in the Toronto area, so I've been talking to everybody about how they shut down parks and stuff. They have done none of that here. I'll go on to say I teach at 2 schools. Everybody who comes into the school has their temperature checked and has the cleanser, the alcohol, 75% alcohol sprayed on their hands. Everybody.
People in Taiwan are serious about physical distancing measures, but he says otherwise, life remains fairly normal.
They didn't shut down banks, work, anything like that. Nothing was closed.
When the coronavirus was beginning to spread around the world in late February and early March, Johns Hopkins University predicted Taiwan would have the second most COVID-19 cases in the world. Taiwan has direct flights to the virus epicenter in Wuhan, China. Millions of visitors travel between mainland China and the tiny island state every single year. Taiwan is also very densely populated, home to around 23 million people. The devastation seemed inevitable, but that's not what's happening. As we record this, all of Taiwan has less than 500 total cases and 6 confirmed deaths from COVID-19. 6. When you compare that to the tragedy of Italy or the US or even Canada, with more than 1,500 deaths in a little over a month, Taiwan's numbers look like a best-case scenario. In fact, their curve doesn't look like much of a curve at all. It's almost a flat line.
To see what happens in Canada and stuff and the empty streets and closing parks and all these things, it's interesting because every culture has a different version of what is deemed healthy or what measures you should take to prevent disease.
Months before the World Health Organization declared this a pandemic, Taiwan was already aggressively testing and tracking where the virus was moving. They also began tracking every suspected case very closely, whether or not they tested positive. Remember that part. We'll dig deeper into it in just a minute. Do people in Taiwan think, yeah, that seems pretty rational what they're doing, or is there pushback?
No, there's no pushback. I am a teacher here, so you see it. Kids listen and are not heard from. You listen. You're taught that from a young age. That goes into the social order when people are adults as well. I see here that there's more of a collectivism instead of individualism. Everyone wears masks and does these preventions because that's what you're supposed to do.
So what exactly are Taiwan's policies that are keeping the virus in check? Coming up, we're talking to a doctor who's studying their approach and whether we can do the same things to slow the rate of infection and the number of deaths everywhere else. We're talking now to Dr. Jason Wang. He's the director of the Center for Policy, Outcomes, and Prevention at Stanford University School of Medicine. He's published a study in the Journal of the American Medical Association on what Taiwan has done to keep COVID-19 under control. So Dr. Wang, thank you so much for making the time to talk to us.
Thank you.
So relative to how the rest of the world is dealing with COVID-19, Taiwan has become one of the best case scenarios in the world. What has Taiwan specifically done differently compared to most other countries?
I think one of the things they did was they took early action. So as early as January 1st, they were on board the airplanes of the flights that were coming from Wuhan, China, and they were checking passenger symptoms for fever or cough or respiratory symptoms. And very soon after that, they had decided that there's a possibility of human-to-human transmission, so they stopped all the flights from the epicenter. They also immediately activated the National Health Command Center, which allows integration of data from different government agencies, both locally and from the central government. And immediately they had decided that they need to make data-driven decisions. So they integrated the immigration and customs database, and they sent batch files from that database to the National Health Insurance database. And so when a doctor sees a patient, he or she will get an alert and says, oh, this patient just came back from Wuhan in the last 14 days, just 14 days data. And they will probably do things differently, like wear a mask, protective gear, maybe order COVID-19 test. So it raises their index of suspicion that this may not be a common cold. And so they were just on very high alert. The other thing that they did was they triage people at the airports.
Lee Skyped with us during her hour-long journey through the Taipei airport. The first step Taiwan took was identifying possible cases.
They gave me this form to fill out my temperature in the next 14 days.
After somebody lands in Taiwan, for example, you could scan a QR code, which leads to a online declaration form. You're required to fill out your travel history in the last 14 days. And also, if you have any symptoms of respiratory symptoms like cough or fever, and then you are asked to fill out your contact information, such as your cell phone and the place that you're staying. And so all those allow the government to separate people with high risk from those with low risk. So for people who have traveled to level 3 alert areas, such as Wuhan, they are asked to do home quarantine for 14 days. And so during home quarantine, the government will bring you food. They will check up on your symptoms 3 times a day. And if you get worse, they will help you to get care in the hospital. So health officials will help you to arrange for that.
They brought food to people in self-quarantine.
Yes, and to their homes, to their residents. And so more recently, they also pay people to stay in quarantine. So they pay equivalent to a young person's daily wage. Every day, they ask people to stay in quarantine. Now, if somebody decides to break quarantine and go out when they're not supposed to, they will get a big fine, equivalent to several months of salary. So you either get paid for complying with the regulations or you get a big fine. But nobody likes to be in quarantine for sure. But it's a necessary measure during an epidemic.
I've seen you liken Taiwan's response to getting a head start in a 100-meter dash, that they were very aggressive very early on, and that's a big part of the reason why. Is that accurate?
When we prepare for a race, and in this case, it's a race against the virus. So when people say ready, set, go, they start running really fast and try to beat the virus to it. And I think in many places around the world, including the US, we had a late start. So when you had a late start, you need to run really fast. But, US and I think Canada, both countries have enormous capability, a lot of smart people. And I think, we could pull ourselves together to run really fast and try to put a stop to what the virus was doing.
You mentioned it a lot there, too, of how Taiwan is tackling the coronavirus is by using data. They're tracking citizens, and they will know if people who are quarantining are not following those stay-at-home orders. How exactly are they using this data?
So it's sort of the way you get your cellular signals, right? Sometimes you have like 1 bar, sometimes you have 2 bars, sometimes you have 3 bars. So they use the cellular towers to triangulate the location of the person with the cell phone, right? So they say somebody decides to turn off the cell phone. Well, they will know that because they get no signal. So basically, they use the cellular signals to try to figure out where you are, and they call it the electronic fence. That's not GPS. GPS, they know exactly where you are, but this sort of cellular phone triangulation, they know approximately where you are. Anybody with a cell phone are already getting these triangulations from your telecommunication companies. So they're just using that to track a person during an epidemic.
It's using existing cell phone technology already.
Exactly, existing cell phone technology.
I just want to go back to 2003 for a moment, during the SARS outbreak. And I've been reading about how Taiwan learned a lot from that outbreak. What did Taiwan learn back then that they're using now during this pandemic?
Yeah, so I think one of the things they learned is that, you have to take actions early. And even when a definitive diagnosis are not ready, that you have to use a proxy. For example, during SARS, fever is a major indicator of somebody with SARS. Early in the SARS epidemic, the tests weren't ready. But then people were getting infected and dying. So they use fever as a proxy. So anybody with a fever, you cannot go into public buildings. This is what's happening to us here too with COVID-19, because when tests are not available, you have to use a number of clinical indicators to say, there's a possibility that somebody might have COVID-19 and you have to take protective measures. The other things that they learn is that you need to have good personal hygiene. Like you need to, wash your hands all the time. And that's something that needs to be communicated to the public over and over again. And then the other thing is to be prepared for the protective equipment like PPE. The government this time quickly, within a few days of activating the National Health Command Center, they said, well, we got 44 million surgical masks in stock in the country. There's 23 million people. So there's like less than 2 masks per person. So that means we have to make more very quickly, and you cannot export them and you cannot bid up the price. The government now controls the price. So they increase the capacity of making masks from 2 million a day to 10 million a day.
Wow. They really ramped up the production.
Ramped up the production to 10 million a day, and now it's up to like 12 million a day. So now they're donating masks, 10 million masks to, Europe, to the United States, and, many other countries. And so now they make enough so the kids are still going to school. People are still going to work because they have PPEs and they have learned to wash their hands. And every time they go into a building, there's a temperature scanner. And if you light up, you need to have your official temperature taken. If you have a fever, you can't get into the building.
In Taiwan, culturally, among the general public, is there a different kind of social contract compared to here in Canada or in the US? Is there a social contract where citizens say, well, I'm going to follow the rules during an epidemic or a pandemic, and that's just the way it is? Is that the way people react to situations like this?
Yes, and I really liked your term too, social contract. And I think that's exactly what it is. That when people have gone through a crisis together and they remember it, they remember how, people could get devastated by it, and you could lose your family members, and you could lose your colleagues. And so, people are more alert, not only to protect themselves, but to protect their family members and other people. So for people under quarantine, if they decide to go out, the public is really angry at that person because they don't think that person should have gone out and to, possibly hurt other people because they could spread the infection. People are very supportive of government's measures. In fact, the current administration has a 90% approval rating for handling the crisis. Now, this is a vibrant democracy where 75 to 80% of the people vote in the presidential election. Mm-hmm. So if people are not happy with the government, they will vote them out. 90% of people are approving what the government is doing right now. And that means you have public support.
The numbers are bearing out that what they're doing is successful, right? In terms of how many new cases there are, how few deaths that there are. Do you think that in a Western democracy like Canada and in the US, is it possible to do something like Taiwan's plan? Because when people hear big data, they will often think this is an example of a police state or that this is an infringement on privacy. Is what Taiwan is doing, is that even possible in Western countries?
I think so. And I think you have to explain to people, if you're collecting data, where is the data going to be kept? Who's going to have access to them? And how long do they get to keep it? If it's to protect the public so people could go back to work, I think people will accept it as long as you tell them what the terms of the data use agreement would be. We live in unusual times, and a lot of what Taiwan has done is supported by law. So they have a Communicable Disease Control Act that they had amended. Government has special powers in an epidemic, which would disappear after the epidemic. And so they don't get to do this forever. Even the case of immigration data, they only get the 14-day data where you have been in the last 14 days because the incubation for the virus is about 14 days. And so, you get the data that you need. You don't try to get everybody's data and integrate it. You get the data that you need to contain the virus.
What do you think we can learn from Taiwan in how to handle this, especially if there is another epidemic or if there is a pandemic in the future, which, as we've heard from public health officials, that's likely, that this kind of thing will likely happen again. What do you think we can learn from Taiwan?
First of all, I think to be prepared. And when I say be prepared, I mean, you need to think about the structure and the infrastructure of your health system, the data you need, and how to, in emergency situations, integrate some of the pieces so that you could use it for disease detection. And so that needs to be well thought out. You need to support it with laws that will allow government to activate that when necessary. when facing with a virus that we don't know exactly how it's spreading or how deadly it is, it's better to be more cautious and take early action and nip it in the bud than to have it spread and try to clean up afterwards. And so it's just a different approach. Or if you contain it at a very low level, you buy yourself time to ramp up the production of testing, to ramp up the production of PPEs. Now, we're sort of in the US and I think many places in the world, we're doing it backwards. It's in community spread. So now we have to think about social distancing first, which is working. But then we have to say, well, how we put people back to work? And that also requires testing, right? Mm-hmm. Testing for people who have the virus, for the antigen, the virus itself, and testing for people who have the immunity, the antibody. And so you also have to do testing. You also have to do social distancing. You also have to make sure that what do you do with public spaces? Do you screen for a fever? Do you make sure that, you have certain PPEs in place? Like, do you provide masks? And contact tracing, right? So for people who have it, you still need to do contact tracing. So all of these capabilities needs to be developed for deployment all throughout the course of the epidemic in order to get us back to normal lives. And so just being prepared and being thoughtful. Some moves you could take your time, but other moves you do it right away. So the logic, the sequence, the tempo. Then you need to articulate it to your people in communications. So after you have thought through it as a government, you have to get support from people in a democracy. So you say, we've thought through it. This is what we think the logic is. This is how we're going to do it in terms of the sequence. And how fast are we going to do this? And we need your support. We're learning a lot of lessons here. And I think we still use it for this epidemic because it's still months away before we could actually put it away.
You don't think it's too late to try a plan like Taiwan's here?
No, not at all. Not at all. Any province in Canada could quickly figure out how to put together certain data for you to make decisions. For example, how to open up cities, how to open up your industries. When you send people back to work, who do you send back to work? How do you make sure that they don't contract the disease? And if they do, you could contain it. And you could do contact tracing. So you could mitigate even the cost side, right? The risk. And then the benefit, obviously, is you get the economy back up. A lot of the times we go with our gut, and this is not the time to go with your gut. This is the time to go with data and to go with evidence-based decision-making. So what does the evidence say about opening up cities like mine? What's the evidence say about sending kids back to school?
Thanks, Dr. Wang.
No problem.
And that is Dr. Jason Wang from Stanford University School of Medicine. He's taken a close look and published a study about Taiwan and the approaches they're using to flatten the COVID-19 curve. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Cheung, Saba Aitazaz, and Raju Mutar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star Newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.